I'm Annette Parkes-Considine. I'm a registered nurse, I'm a credentialed diabetes educator, I'm a certified pump trainer, and I help run clinical trials here at Hunter Diabetes Centre. When you walk through the doors of Hunter Diabetes, you're not judged by your numbers. We all know that your numbers as someone with diabetes are going to be wonky. We just look at it and try and help make them better. We look outside the box. If there's anything we can do to try and make your numbers better, we'll try it. Today we'll be talking about foot care. People with diabetes know that it's important to look after their feet, but why is that? The reason is that the longer we've had diabetes, the higher risk we are of developing foot-related complications. Sometimes the circulation to our feet isn't real flash, and sometimes the sensation to our feet changes and we're not aware of when we've got wounds and changes going on with our feet. Every day it's important once you've had your shower to check in between your toes, make sure that they're all dried properly, nails are cut straight across, and any wounds or any cracks, blisters, any lesions are dealt with and looked after by your healthcare professional. Infections can start very quickly. About 75% of amputations that are diabetes related can be avoided with good foot care. If you're unable to look after your own feet, get someone close by. If you've got someone in the house with you, just get them to have a look at your feet every day to make sure that they're nice and healthy. If you don't have anyone with you and you're unable to look after your feet yourself, you can use your visits on your care plan through your GP to access a podiatrist who will help you do that. In addition to that, your practice nurse, your diabetes educator, your GP and your endocrinologist will all check your feet on a regular basis to make sure that they're nice and healthy. Today we'll be going through what a foot care entails. So there will be a step-by-step on what you'll expect to have happen when you go to the doctors so that there's no surprises. And trust me when I tell you, it doesn't hurt. When your healthcare professional's looking at your feet and doing a foot assessment on you, they will check the lower part of your legs. So what they're looking for is they're looking for hair growth to make sure that all the nutrients are getting to your feet properly, even hair on your toes. And I know that people think that that's funny, but hair on your toes is actually a good thing when you've got diabetes. We feel for pedal pulses, we feel for post-tib pulses. Your healthcare professional will be looking in between your toes to make sure that there's no cracks, that there's no wet areas, to make sure that you've dried in between your toes properly. They'll be looking for capillary refills, so they'll give you a big toe a bit of a squeeze and they'll blanch that just to make sure that all the blood flows back in there quite quickly. Again, it doesn't hurt. They'll be checking your heels and other pressure areas to make sure that there's no cracks or wounds, and they'll also be doing a monofilament test on you. A monofilament test is a painless test. It only takes a couple of minutes and it's just to check the sensation underneath your feet. So it's a little wobbly plastic thing and your healthcare professional will just make sure that your sensation right on the bottom of your feet is normal. Sometimes people get wounds on their feet and they're not actually aware that they do have those wounds because they don't have that sensation, so they've got numbness on the balls of their feet. So remember, when you do have diabetes, it is really important to take good care of your feet, and if you've got hair on your toes, it's a good thing.